Hey everyone, it's Dr. Brenda at Revitalize Physical Therapy. So thanks for tuning in today. What we're going to talk about is incontinence. So all of that leaking, peeing your pants, running to the bathroom, those types of things we're going to cover today, and a couple things of what you can do to kind of help alleviate that. So before we get started, just a couple of quick things. There is a link in the description of the video. If you want to download the link, it's a link to our free report on incontinence. So it'll give you a little bit more info and tips and things you can do at home than what we're going to talk about today. So if you're looking for more information, click the link, download the free report, and then you'll have access to a lot more stuff too. Another thing is, feel free, if you have questions at all, write them down in the comments on the video, give us a thumbs up so we kind of know if you are kind of understanding it, if you have questions, and if you're watching this after the fact and not live, you can still comment on the video. We'll still get back to you, or you can always send us a Facebook message or email if you have more specific questions or don't feel comfortable putting it out there on Facebook. That's fine too. So, and as I talk, feel free, if you have questions, just throw them out there. Love to answer them. But first thing is, what is incontinence? So maybe you've heard of it, maybe you're not totally sure, but incontinence is considered any leakage at any point other than your first 6 weeks after having a baby. So a lot of people think that, oh, it only happens every once in a great while, or it only happens when I sneeze or cough, so that's not really incontinence. It is. There's just a really wide range of, what is considered incontinence. So if you're having any leakage, it's not normal. And what I tell people all the time, incontinence is common, but it's not normal. It's not something that you have to live with, and it's not something that you should just accept as being part of everyday life. And some of the common misconceptions, as I mentioned, only happens if you cough or sneeze, but a lot of people think like it only happens to those that have babies too, and that's also not true. So we'll talk a little bit more today about why that's not necessarily true. It can happen to anyone. It can even happen to men. We're not going to cover males. Sorry, guys. We're only going to talk about women today because it's another set of issues, essentially. So, but it can happen to anyone. Just know that. The other thing, too, that I always kind of like to point out is that there's different types of incontinence. So there's stress incontinence and urge incontinence. Stress incontinence is what you typically consider as incontinence. So that's when you're leaking during some type of activity. So the most common is sneezing, coughing, laughing, running, maybe jumping on a trampoline. A lot of you moms out there know that jumping on a trampoline might not be great. So that's kind of what stress incontinence is. It's you're doing some type of activity and leaking during it. Urge incontinence is a little bit different. Urge is kind of like you get this really strong sudden urge. It comes out of nowhere and you're like, I have to get to the bathroom like right now. So oftentimes there tends to be certain triggers. For a lot of people, it might be like as they pull into their garage after running errands, they're like, oh, I have to get to the bathroom right now, and rush inside. Or maybe it's you hear running water and it triggers it and you're like, I have to go to the bathroom. That's considered more urgent incontinence. And so if you do go to the bathroom, you may always go to the bathroom, or sometimes you might get there and then figure out, oh, you don't really have to go. So you could have kind of either. It also sometimes goes hand in hand with going to the bathroom a lot. So frequency, urgency and frequency go a little bit hand in hand, but you don't necessarily have to have one to have the other. So that can be a little bit more tricky or complicated to understand. I want to kind of show you something too before we kind of dive in a little bit on pelvic floor. But I saw this in a magazine I was reading, if you can see it. It's an ad for Depends, so the adult diapers, if you're not familiar. But now what they're doing is making them floral print and also more fitted so that you can feel better about wearing diapers all the time. I saw it and it just kind of like, I don't know. It just drives me nuts because it shouldn't be like that. You shouldn't be wearing a diaper. You shouldn't have to. There are other options. So if you've seen that or have been wondering, or maybe you're in Depends or wearing pads all the time, just know it does not have to be like that. That's not normal. You know, they're trying to make that very normal nowadays, and it's not. So leaking, peeing your pants, not normal. All right. So what we're going to do, so you can kind of understand a little bit about what is incontinence, why does it happen, and what you can do, I thought it would help to kind of go over the anatomy a little bit. So I brought my pelvis here. Really quick, just to kind of show you, and let me know if you can't see this. Give me a thumbs down if I'm not holding it up high enough. But you have your pubic bone in the front here, in the back. This is your sacrum, so this triangle piece of bone. Sacrum, your spine comes up from there, and then your tailbone's down here. These two bones here, these are your two hip bones, your pelvic bones. So everything inside, this would be looking from like top down into the pelvis. All of this is pelvic floor muscles. So it connects from the front all the way to the back and also side to side. So it creates this entire floor of the pelvis. You also have different layers of the pelvis. So if you're looking from bottom up, you have your most superficial layer. Kind of creates these triangle pieces here. And then you can see it a little bit more around anus, but you have these circular set of muscles. Those are called sphincter muscles. So their jobs are kind of keeping the tubes shut. You have one here, and they kind of help close that and keep everything inside when it's supposed to be inside and let stuff come out when they're supposed to come out. So most superficial, just as a fun fact, for those that have had children, if you have had any kind of tearing or an episiotomy, this is the layer of muscles that you would tear through first, and the lesser degree of tearing is here. As it gets more severe, you get into this deeper layer. If I take that off, you can see the deep layer here. So when you think about doing Kegels, if you've heard of Kegels, which most of us probably have, and you've probably been told at some point in your life, do your Kegels, are good for you. This is really the group of muscles that you're working here. So it's that deep layer that tend to do the bulk of the work. The superficial layer is still very important, but they may not, parts falling off of this thing left and right. They may not do quite as much as that deeper layer does. So what that floor does essentially kind of holds everything up in space. So you have bladder, uterus, and kidneys, ovaries, they're all kind of suspended up here in space inside of the pelvis. So they're kind of like up here, just held up here with ligaments. And then the muscles kind of form the bottom part of that, and it helps hold it up. And it also holds everything else up, so all your other abdominal organs as well, intestines, etc. So it provides the most support for that. It also helps, as say you sneeze, that increases a lot of pressure inside of the trunk. And so it helps manage that pressure and keep it from getting too great where you would have some kind of issue or injury because pressure is too much inside. So it helps monitor that. It also helps work with like your diaphragm and all your abdominal muscles. So I like to show my water bottle here as an example. your pelvic floor is on the bottom, your diaphragm's up on top, and your ab muscles are on the front and your back muscles on the back side. So all together, they create this cylinder, which would be your trunk. And so the diaphragm and the pelvic floor basically work together. So as the diaphragm drops down, when you inhale, the pelvic floor should drop down and relax. Then as you exhale, it lifts and the pelvic floor contracts and lifts. So that's normal function that kind of happens all day long without you even knowing it. In an ideal situation, oftentimes there becomes a disconnect between them and then we start to have issues. So enough about anatomy. Some of the causes for incontinence. How many of you think that incontinence happens because the pelvic floor muscles are weak? Show of hands. If you're watching right now live, give us a little thumbs up. How many of you think that maybe it happens because the muscles are too tight or they're working too hard, they're overactive? What about both? So answer would be both, kind of a trick question. So you have weakness and you have what we call overactivity. So the muscles are too tight. Both of those can occur in the pelvic floor, and they can both lead to incontinence. So the most common thought process is that the muscles are weak. And yes, that's very true. That does happen for a lot of people. The muscles can't contract. So when they contract, also known as a Kegel, they're kind of squeezing and lifting. So I always tell people it's kind of like you're trying to pick up a blueberry with your lady parts. So you want to squeeze and pull it up, but you don't want to crush it and you don't want to push down on it. Most women do Kegels incorrectly. They say about 80% of women do them wrong. So really it's kind of this squeeze and lift. A lot of people have difficulty doing that and they have weakness. So if the muscles can't work as well, it can't hold everything in and it can't contract when you're doing activities such as jumping, and then we leak and have issues. On the flip side though, sometimes the muscles are working too hard and they're overactive and they're too tight. So I always like to tell people it's kind of like if you're really stressed out and your shoulders are stuck up here, you can't really shrug your shoulders that much more because they're stuck here. They're tight. That can happen on the pelvic floor as well. And then when that happens, the muscles kind of tighten up and they stay like that. They don't relax all the way. Because of that, they can't contract anymore. So you'll still have leaking issues because they just can't function. So it's actually more common than you would think. You know, most people always think of weakness. That's kind of the typical thought process. But I see it quite a bit, especially in women, runners, CrossFit, really active women that exercise a lot. Those populations tend to have more issues with this, that overactivity, that tightness, than just straight weakness. So what you can do to kind of know, because if you have issues where the muscles are too tight, if you're trying to do Kegels, it's only going to make that issue worse. So a way to kind of test it on yourself, what you can do, I want you to think of doing a Kegel. So you're going to kind of squeeze and lift. You should feel your pelvic floor kind of draw up and in. Then I want you to relax it and try to bulge down, kind of like you're trying to have a bowel movement. So you're kind of like pushing. You should feel that pelvic floor drop down and relax a little bit. If you can't feel both of that, so that lift and that relaxation, then something, it might be kind of stuck there. So it might not be working a ton. Just kind of making sure I got your question here, Ashley. So you should feel a nice lift and a nice relaxation. If you're not getting that and you're like, I'm not really sure, or you're trying to do a Kegel and you're like, I don't even know if I'm feeling this lift or what's going on, it's very possible that you might fall into that category of things being overactive and too tight. And if that's the case, you know, Kegels definitely you don't want to be doing. So we're going to cover a couple other like tips in a minute here. But you know, it's kind of a rough estimate for yourself to see if you're maybe which category you're falling into. Okay, does that make sense? Give me a thumbs up if that answered your question. The other thing I wanted to touch on before I forget. So I mentioned earlier that incontinence can happen with anyone. It doesn't necessarily happen with women just that had children. With all women, as we get older, we get into closer to menopause, and we get into this like premenopause phase where your hormone levels are changing. When that happens and we start to lose our estrogen, our muscles actually get weaker, and it happens all over the body. So your pelvic floor muscles will actually get weaker as you get older. So oftentimes, you know, women may be fine, you know, for many, many years, and then they kind of get to like age 40, 45, 50, and it all kind of starts to fall apart, and they start to have issues where they never did prior to that. So hormones can play a big factor in your muscle strength as well. So kind of keep that in mind. You know, and I always tell people too, like, if you're younger, maybe 30s, and having some of these problems, they're not, you know, too bad, or you feel like you can kind of live with it or manage it. Oftentimes they'll get worse as you get older. So keep it in the back of your mind. Sometimes it's better to address it earlier than kind of keep it, you know, going and wait until it gets worse, because with hormone changes, it's going to affect things a lot. So that's why sometimes women will be fine all the way until, you know, age 45, and now all of a sudden they're leaking. So hormones play a big factor with your muscle strength and your function. The last kind of cause of incontinence, so we covered, you know, what the muscles are doing. Are they weak? Are they too tight? But there's also habits that you do, bladder habits, or things that you drink or eat throughout the day. Now, this can impact stress incontinence with the leaking. It also has a pretty big impact, and more so with urge incontinence. So when I say bladder habits, I mean, you know, if you start to essentially train yourself on going to the bathroom. So for an example, maybe you're like about to go out to Target, and we all know how our trips at Target get, ladies, right? I'm not the only one that can't go in and buy one thing. So you're getting ready to leave the house, and you're like, maybe I'll go to the bathroom, like just in case. I don't want to have to stop and go, or go when I get to the store. So you maybe don't have to go very bad, and then, you know, go to the bathroom, kind of force yourself. Oftentimes women start to do this more and more and more. Or if they're having leaking issues, especially with like exercise, the thought process is, oh, I'll just go to the bathroom like before I exercise because then I won't leak. What happens is you start to train your bladder to not fill all the way because you start to do it over and over and over again. And so then your bladder might only get maybe like halfway full, and it starts to tell you, hey, we need to go to the bathroom. Like, let's get going, find a bathroom. Even though it really should be able to fill quite a bit more before you get those signals. So then you start to feel like you have to go to the bathroom all the time, and you might go to the bathroom, but you start to create these habits, and now you're going multiple times a day, all the time, or maybe you can't go and run errands without having to go to the bathroom first. So that's where some of those that urge incontinence starts to come into play then, because you start to form these habits and train your body to do those types of things. The other thing too is, what are you drinking and eating throughout the day? So there's things like bladder irritants that can affect, how often, how frequently you have to go to the bathroom. So for example, have you ever had a cup of coffee and noticed oh, now I'm going to the bathroom all the time right after I just finished this cup of coffee? So what that does is that coffee is irritating the bladder, and the bladder is I'm trying to get it out because it's irritating. So you're going to the bathroom all the time. So it can make urge incontinence worse. It can also make stress incontinence worse. Another example, I had a patient once that drank 7 Diet Cokes a day. Just reading your comment, Ashley. So 7 Diet Cokes a day, and was having a lot of incontinence issues and leaking, and we cut down her Diet Coke, and symptoms drastically improved just from that small change. So a lot of times that frequency, that urgency are really impacted by that, but it can even contribute more with leaking as well. So kind of paying attention to what are your habits, and if you notice if there's certain triggers, like every time you run errands or whatever it is, kind of pay attention to that, because that can impact it. So does that all kind of make sense a little bit about some of the different causes? Give me a thumbs up if it does. So what can you do? So maybe you're having these issues. If you're dealing with it, know you're not alone. There's so many women out there dealing with this stuff. And it's often sometimes not something that we tend to talk about. It's not typically dinner conversation. So I'm going to give you a couple tips today, things you can start implementing right away to help improve this. So tip number 1, making sure you're drinking your water. So aim to get about 8-ounce glasses of water in a day. So roughly 64 ounces or so throughout the course of your day. And that's just plain water. So juice doesn't count, or flavored water like LaCroix, things like that, that doesn't count as just our water. So the reason being is, if you're drinking enough water, your muscles will be well hydrated. So your muscles can work properly. You can get the most amount of strength out of your muscle when it's hydrated well. If you're really dehydrated, you're going to be a lot weaker, and that's throughout the body, including the pelvic floor. The other thing is, if you're dehydrated, that irritates that bladder. So what we just talked about, you want to kind of minimize that. So having enough water keeps the bladder happy and makes it a lot less likely to have more of these incontinence issues. So that's number 1, get your water in. The second one, kind of going hand in hand, is avoiding other bladder irritants. So the general categories of bladder irritants include alcohol, caffeine, anything that's carbonated, anything that's acidic. So your juices tend to be acidic, soda, and then what am I missing? Oh, artificial sweeteners is the other one. So those big categories. So when I mentioned that Diet Coke, that has almost all of those categories in it. So Diet Coke, Diet Pepsi are really bad for you when you're having pelvic floor issues. So trying to minimize those throughout your day can be a big factor. Or I always tell people, kind of pick your poison. I always have coffee in the morning. I'm not going to give it up, but maybe not drinking it all day long. Or, if you're going to have coffee, make sure that you're having water with it to help kind of dilute it and minimize that impact on the bladder. And yes, decaf coffee still counts because it's still acidic, so it can still irritate, maybe not quite as much as regular coffee. So trying to avoid those things, paying attention to what are you drinking throughout the day, that can make a big impact. The second one is third one, only going to the bathroom when you need to go. So we talked about these bladder habits. You don't want to try to form those habits. So try not to go to the bathroom unless you really have to go. So I know, it's maybe not always the most convenient, but don't force yourself to go to the bathroom if you don't have to. There's always going to be instances, like say you're going on a big road trip and you don't want to stop in a half hour. If you do it once in a while, it's not a big deal. It's when you start to do it all the time. So, really try to pay attention, like, do I have to go or not really, and don't force it. So you kind of want to wait until you have a pretty strong signal, like, hey, you have to go to the bathroom. Not all the way like, I can't even hold it anymore, I'm gonna pee my pants, like my bladder's so full. That's too far. You kind of want like that happy median of like, I have to go and I know I have to go, it's pretty strong, that's the time to go. So if you can kind of stick to that, that will help a little bit too. For those that are struggling with like urge incontinence already, it's going to be very, very difficult for you to not do that because your urge does feel very strong. So that's something that would take a lot of different treatment. But if you can try to keep that in the back of your head, it might help a little bit with it. The last thing too is really having a proper assessment of the pelvic floor muscles. Obviously I'm biased, but pelvic floor PT really is kind of the best way to know what exactly is going on. So as I mentioned, you can have weakness, tightness, all these different like bladder habits. There's multiple factors involved. And so I hope you've kind of shown or seen that it's a little more complicated than, oh, just do your Kegels. Having a proper assessment will tell you exactly what's going on so that we know where we need to work on addressing to get you able to do everything you want to do without having these issues. So oftentimes people have tried doing Kegels on their own, or maybe they've brought it up to their doctor and they're like, oh, just do more Kegels. Or if you've been told like, well, you had a baby, or oh, you're getting older, total crap, don't believe it. But you do need to know what exactly is the issue and how are you going to start putting those puzzle pieces together. If you've tried Kegels in the past on your own or done them for a while and things aren't getting better or you're still having issues, then that's the time, like, you need to come in, have it looked at, and find out what's going on with them. So you're not wasting more time, more energy on something that's not going to work. So if that's the case, and you're kind of ready for that, feel free, you can always reach out. We'd love to kind of help you and answer questions. If you've got questions, more than happy to answer whatever you've got. So feel free to drop us an email or a Facebook message, and we can get back to you on that. So any questions before I kind of wrap it up? For those that are watching live?
Covered by insurance.
Covered by insurance. Okay, good question. So yes and no. Pelvic floor PT can be covered by insurance. Oftentimes they're very finicky in terms of what they will cover and what they won't in terms of treatment and how much treatment you get, because oftentimes insurance companies, they look at it as, well, you can do all of the things that you need to do in your daily life, you're just peeing your pants, so it's not really functional, and they'll stop paying. So yes, you can have it covered, but there are a lot of limitations. So here we work it a little bit differently. We function as more out of network to kind of get around those loopholes, and we can give people exactly what they need and then submit it over to the insurance as an out of network provider to have it covered that way. And then that seems to work really well with getting people what they need to get better, and we don't have those limitations put on us. So does that help answer things a little bit or make sense? Insurance is so confusing. It's such a mess, eh? Awesome. Well, feel free, if you have more questions, drop them in the comments. We'll still keep checking and we'll get back to you too. Otherwise, don't forget, if you want to click that link in the video description, that'll give you our report to give you more tips on things you can do at home. And if you're interested and you have questions and want to know more about like what would it take to kind of fix your issues, what are you looking at? What does that look like for therapy? Shoot us an email and we'd be happy to kind of set up a time to chat and we can answer all your questions then. So, well, thanks for watching today, and I hope you have a great day. Have a great Christmas next week, and let us know if you have questions after this. See you later.